In the wake of Covid-19, supporting older people to eat well, age well and live well has never been more needed. And of course, Covid-19 touches every part of our lives. And at the start of this year, when we were coming to the end of the research, we were hoping for a parliamentary event to be launching this. However, it's great that we can go ahead in the format that we're in to share this learning and launch the new research, which has never been more relevant. So I'm delighted today to be alongside Dr. Kate Reid and Professor Catherine Lido, who led on the research that we're jointly launching today, and we'll hear from them. I'll give a bit of an overview of the journey to this research, and then we'll also hear from Laura Cairns, who leads our Eat Well, Age Well project, to hear a bit more about the progress that we've been making over the last 3 years. But firstly though, I'm really delighted and pleased to welcome today Claire Adamson, MSP for Motherwell and Wishaw, who is with us today. And Claire's going to be able to say a little bit about Scottish Government and its plans and meeting commitments around tackling malnutrition among older Scots and the importance of this research.
Many people have faced unprecedented levels of food insecurity, and the impact of the health crisis, COVID crisis on older people has been keenly felt across the world. The research findings link directly to the themes of food insecurity, loneliness, and health and social care. And while we must emphasise that these are not COVID-19 problems, the challenges faced by older people have been underlined and exacerbated by the outbreak, but we cannot view these through a single lens of the current crisis. The problems existed prior to the pandemic, and our societies recovered from COVID-19 must galvanise systemic and sustainable change. In essence, we must build a fairer Scotland for older people. We must ensure that the challenges faced by older people, food insecurity, loneliness, health and social care, are met with a practical rights-based governance. A rights-based response is needed, in my opinion. To meet the challenges of an ageing population, the Scottish Government strategy, A Fairer Scotland for Older People, a Framework for Action, outlines the priority actions to tackle the barriers to a positive older age identified by the Older People's Strategic Action Forum. It's impossible to cover all of the points raised in this framework, but malnutrition has been specifically identified as a key issue affecting older people, and it seems timely to highlight the issue now. The national commitment was made to tackle malnutrition in A Fairer Scotland for Older People. It's an oft overlooked aspect of public health messaging, so it's heartening that the Scottish Government have included it in the strategy. But there still remains a dearth of public awareness on this problem. Approximately 100,000 older people over the age of 65 in Scotland are at risk of suffering malnutrition. And this is what we must tackle going forward.
I'm just going to move us on next, and I'm just going to give you a little bit about the journey to this research, because its roots are quite long and quite well established. So the journey to this research didn't just start sort of a year ago when we actually were doing the research. It started quite a bit further back. But to go back even further, over 25 years ago, when Foodtrain was set up as an organisation by older people to help other older people with food access. And over those 25 years, we've been developing services to help older people eat well and age well. Governments and their policies come and go, and the world around us changes constantly, none more so than this year. But essentially over the last 25 years, what our older members have asked for us has remained unchanged. It's about food, about company, and feeling safe and cared for as the top priorities. The journey to this research has been a shared vision of understanding the food needs of older people living at home in Scotland, with a collaborative process that was designed and testing this research with older people directly. But what lies behind the data and the stats are the real lives and stories of older Scots. So this journey to this research goes right back to 2012, when the UK government were setting up a malnutrition task force with Westminster Department of Health funding, but that had no remit in Scotland. And that led a number of people working in this field at the time to start to think about what does that mean for us in Scotland and how can we tackle that. Foodtrain continued to lobby the Scottish Government to bring this agenda to the fore. And in partnership with Scottish Government, we co-hosted a malnutrition summit in May 2015. That brought together over 70 individuals, from older people themselves to third sector to public sector to academics, to talk about this issue. And everybody agreed it was the first time that we'd really all been in the room together, and that we needed to keep this conversation going. That report was published and created 13 recommendations that were agreed by those attending. Those recommendations were then discussed by cross-party groups, both the food and older people's groups, and there was calls for some actions on those recommendations. However, that's when things really began to stall, and there was a real sense that we had come this far, but there was nothing really happening. So FoodTrain, with the support of lots of other organisations who'd been involved in the conversations, decided that we could try and do something from the ground up. And we were really grateful that the National Lottery Community Fund came forward with 3.5 years of funding for it, which has allowed us to set up our Eat Well, Age Well project. In preparation for Eat Well, Age Well, we had held 85 conversations with FoodTrain members, talking about their meals and their memories, and that had highlighted so many areas where food was the connecting part in their life to their memories and to how they were living now, and to other people. So we knew it was going to be important that conversations with older people were going to form a big part of this research. And FoodTrain's experience to this point had been gradually watching the social care system cuts that had been leading to that increasing deficit in the provision of food access, community meals, meals at home, and the opportunity to eat with others. And a clear knowledge gap that was about understanding food insecurity for older Scots and being able to separate that out from the financial insecurity side, but being able to understand what might be the associated links between malnutrition and social factors. So that brought us to this research partnership, so that it was underpinned by a long period of work that brought us to the point of being able to pull something together with the help of Glasgow University. And I'm delighted that we've got to the point today that we're able to publish this research. So we knew that we wanted to look at older people at home, their nutrition, their food security, their well-being, and those loneliness measures.
And the research took place over 12 months, which is quite a short research cycle. So as a result, we were pretty ambitious, and we had a number of aims, but the two that are particularly relevant to today are, we wanted to evidence the impact that the FoodTrain services was making on key outcomes related to both physical health and psychosocial health for older people utilising its services. And we looked at, in comparison to those individuals that maybe were doing okay at home on their own, but maybe with friends and families stepping in as and when required. We wanted to use these findings to enact change, to make a difference, as we want to do as researchers. We don't want to just do research for the sake of it, we want to make a difference. So, and part of today is evidencing that. We want to cascade these research findings more widely to establish networks and to the Scottish Government to inform and strengthen existing and future policy going forward. Also to think about the expansion of services and the more secure expansion of services, not just in terms of emergency response that's been witnessed through COVID, but a long-term sustainable service to older people as they age at home. Our partnership with FoodTrain and Eat Well, Age Well focuses on what's termed ageing in place. So how the older person can be supported to enjoy a full and a positive life in their own home or a homely setting. And our focus is on the provision of the social care and third sector support offered within the community, rather than support offered within residential or care home settings. So in particular, we were interested in evidencing the food access issues. So for instance, accessing the food system, shopping, deliveries, preparing, and also the psychological enjoyment of food, which older adults face within their community. Older adults facing food insecurity and risk of malnutrition are also at increased risk of lower well-being, social connectedness, and the levels of control and empowerment that they feel over their lives. However, FoodTrain seem to really play a role in breaking that cycle that Catherine has talked about. So starting to give that person who may be disabled, and have actually quite a lot of health difficulties and psychological differences, but it gives them a sense of empowerment to reach out and ask for help, which is essentially what they had already done by inviting Food Train into their lives. Food Train is supporting very vulnerable older age adults at home. And again, what I said, what little control those food insecure adults have is often attributed to this access to the reliable volunteer-led food delivery service. So the stability of food access to eat and enjoy food provides us with a really critical lens to assess healthy ageing in place. The eating and preparing and sharing of food is inextricably linked to the perceptions of feeling in control, how connected you feel, the physical and mental well-being. And the inequalities we've evidenced are not simply attributable to a lack of financial resources that explain accessing food banks. For instance, it's much lower rates of older adults will access food banks, but it's more about a diminished sense of maybe social and cultural capital, which can affect older adults in nuanced and sometimes hidden ways. We've seen how quickly previously food secure older people can actually be placed in a very insecure experience through shielding and social distancing. Our research can be used to illustrate the critical role of the third sector in providing these upscaling frontline services. And surely nothing is more essential to life than food. We need to further strengthen and secure dignified access to the food system for vulnerable older adults, many of whom we've found are already exhibiting early signs of malnutrition.
Well, thank you so much. I'm delighted to be talking about and raising awareness of our Eat Well, Age Well project. I'm Laura Cairns, the project manager, and I'm going to be talking about our learning and launching our 4 calls to action. And our core focus is on the prevention, detection and treatment of malnutrition among older adults living at home over the age of 65. Just to give a few key facts in terms of what's the problem that we're trying to fix. Well, sadly, and I think Michelle said earlier that the 1 in 10 older people are at risk or suffering from malnutrition. And we can equate this in Scotland to be around 103,000 older people. These are pre-COVID figures. And actually in our own project, we estimate that these figures are higher than this, more like 30%. So that's really unacceptable for something that can be prevented and treated. And it's really a hidden problem, which is often overlooked with the dominance of attention in media around overweight and obesity, and a representation around malnutrition is something that is extreme hunger and only in developing countries. So this has led us to our calls to action today. So you've heard from the research from Kate and Catherine and the journey that Food Train have taken throughout this pandemic, and our work across the project, funding our small grants, our screening, our training. This has led us to identify 4 simple calls to action that, if implemented, could make a real and positive difference to older people's lives and save the NHS economy money and social care. Now is the time for change, and we're launching this today as day 1 of UK Malnutrition Awareness Week. So call to action 1 is focused on screening. Screening for malnutrition should be mandatory for all statutory agencies with a role in supporting older people. We know from the evidence we can prevent malnutrition through early identification and screening. And current data is focused on hospital context. There's no routine recording or reporting in community settings. And this reporting and recording in community settings would allow us a true picture of the nature of the problem. There are tools available. We have the MUST tool, which is validated, and we also have these newer community-based tools that have got enormous contribution for the wider community workforce. Call to action 2 is focused on training. So training on malnutrition, unintentional weight loss and health communication about household food insecurity should be embedded in basic training for all health and social care professionals. We've already trained 467 colleagues in health and social care. We know from that work that many were unaware that malnutrition was a significant issue. So that's why we need to reach more people. And if these issues were embedded in basic training, we would make significant increases in prevention, detection and treatment. Call to action 3 is focused on investment. More and better investment should be made in community initiatives that address social isolation by providing befriending and opportunities for older people to eat, shop and cook with others. We know that investment isn't anything new or revolutionary, but the fact needs to be said again. We've found from our research there's a real correlation between social isolation and malnutrition, and the vital community supports like lunch clubs, befriending, that bring people together to socially eat and to socially connect. This is vital, and these are provided by the third sector and need to be enhanced. So real investment could be made through the Older People's Framework to make a real difference. And finally, call to action 4 is focused on food poverty and food insecurity. These are not the same for vulnerable older people. Policy, practice and research needs to take account for this. So food poverty does not wholly explain why older people face food insecurity. It's much more multidimensional. So we heard from Kate and Catherine talking about factors such as choice, decision making, control, and how food access should be paired with social interaction. It really is time for change. And at the bottom line, we want to look after the health and well-being of older people. So thank you for listening.